Stop considering a facelift. I know that sounds strange coming from a doctor. For years, perhaps decades, you've been looking in the mirror, watching your jawline soften, your cheeks begin to descend, and telling yourself that one day you might need surgery to fix it. I'm here to tell you something important. What's happening to your face is not primarily a surgical problem. It is a muscular problem, and muscles can be retrained at any age. I am Dr. Alan Mandell, and I have spent over 4 decades studying how nutrition, natural compounds, and human biology interact at the deepest cellular level. And in those 4 decades, I have learned something that most people, including many physicians, completely overlook. Your face contains over 40 muscles. 40. These muscles are unlike any other muscles in your body because they are not attached to bone. They attach directly to your skin. That single anatomical fact changes everything about how your face ages. If you stay with me until the end of this video, I'm going to reveal the single most powerful facial exercise I've found in my clinical experience. One that combines resistance training with lymphatic drainage in a way that can produce a visible lift in a matter of days. It's worth every minute. Stay with me. That final one is worth every minute of your time. Now, before we go any further, I'd love to hear from you. Drop a comment below with your age and tell me which area of your face concerns you most right now. The jowls, the neck, the forehead lines, or the marionette lines around your mouth. I read every single comment on this channel, and your answers genuinely help me shape the content I create for you. Now let me explain the mechanism, because understanding the mechanism is what separates genuine science from folklore. Your face is supported by a complex network of over 40 muscles. The zygomaticus major and minor that lift your cheeks when you smile, the masseter that powers your jaw when you chew, the frontalis that raises your eyebrows, the orbicularis, or that surrounds your mouth, and critically, the platysma. The platysma is a broad, flat sheet of muscle that begins at your collarbone, runs up through your entire neck, and attaches just beneath your jawline. Think of the platysma as the hammock that holds your lower face in position. When you were 35, that hammock was taut, strong, and well anchored. But here's what happens after 50. Just like the muscles in your arms and legs, your facial muscles undergo something called sarcopenia, age-related muscle atrophy. The muscle fibers literally shrink. They become thinner, weaker, less dense. And because facial muscles are uniquely connected to your skin rather than to bone, when they shrink, your skin has nothing left to hold on to. The scaffolding collapses, and the skin with nowhere else to go begins to droop, to sag, to fold. That jowl you are seeing in the mirror is not excess fat. It is not a skin failure. It is a muscle that has been slowly starving for movement for 20 years. This is not wellness folklore. It is not something I found on a blog. It comes from peer-reviewed research published in some of the most respected medical journals in the world. In 2018, a landmark study was published in JMA Dermatology. That is the Journal of the American Medical Association, one of the most rigorously peer-reviewed dermatology journals on the planet. Researchers followed a group of middle-aged women who performed a structured facial exercise program for 20 weeks, 30 minutes a day, or every other day. At the end of those 20 weeks, independent dermatologists, physicians who did not know which women had done the exercises and which had not rated the exercise group as appearing up to 3 years younger than their biological age. The participants showed measurable increases in facial fullness. Their cheeks were fuller. Their skin appeared more lifted, and this was not a subjective result based on how the women felt about themselves. This was an objective, blinded assessment by board-certified dermatologists. Now, let me tell you about an even more recent study. In 2025, researchers published a clinical trial investigating the effect of 8 weeks of intensive face yoga on facial muscle tonus, stiffness, and elasticity. They used specialized equipment to measure the mechanical properties of facial muscles before and after the program. The results showed significant improvements in muscle tonus and elasticity. The muscles became firmer, the skin became more resilient, and this study specifically focused on middle-aged women, exactly the demographic that has been told for decades that surgery is the only answer for facial sagging. Do you see the pattern? 2 independent studies separated by 7 years published in respected journals arriving at the same conclusion. Facial muscles respond to resistance training exactly the way your biceps respond to a dumbbell. The mechanism is called muscle hypertrophy. When you consistently apply resistance to a muscle, it adapts by laying down new muscle protein fibers. The muscle becomes thicker, denser, and stronger. In your face and neck, that increased muscle volume pushes outward against the skin from underneath. It creates a natural lift. No needle, no scalpel, no recovery room, just your body's own adaptive biology activated by movement. There is a second mechanism at work here that is equally important. When you exercise these muscles just beneath the skin, you dramatically increase superficial circulation, the flow of blood, oxygen, and nutrients to your very skin cells. Your facial skin, especially after 60, is often undernourished because the capillary networks in the dermis have thinned with age. By activating the muscles beneath, you are opening those capillaries. You are flooding the dermis with the raw materials it needs to produce collagen and elastin. You are essentially feeding your skin from the inside out. And then there is a third mechanism, lymphatic drainage. Your face contains a dense network of lymphatic vessels that are responsible for removing excess fluid, metabolic waste, and inflammatory byproducts. As we age, this lymphatic system becomes sluggish. Fluid accumulates. The face looks puffy, heavy, waterlogged. Facial exercises, particularly when combined with specific directional movements, physically pump this stagnant fluid toward the lymph nodes in your neck where it can be drained. Think of it as emptying a sink that has been slowly filling for decades. Now, here's where things get truly fascinating. I want to tease something for you right now. We are counting down today from number 5 to number 1. 5 facial exercises ranked from beneficial all the way to the most transformative protocol I have seen in my clinical experience. And if you stay with me until the very end, I am going to reveal the number 1 exercise that combines resistance, circulation, and lymphatic drainage into a single movement. That final one is worth every minute of your time. Let me begin with number 5. Exercise number 5 is what I call the cheek lift and hold. This exercise targets your zygomaticus muscles. Those are the muscles that run from your cheekbone down to the corner of your mouth. These are the muscles that lift your cheeks when you smile. After 60, these muscles have been chronically underused. Most adults over 60 smile less frequently than they did at 30. And when a muscle is not used, it atrophies. It shrinks, and the cheek that once sat high and full begins to descend. Here is how you perform it. Place the palms of your hands just below your cheekbones. Not on the cheekbone itself, but directly below it where you can feel the soft tissue of your cheeks. Now gently lift upward, pressing the muscle and skin toward the cheekbone. Hold this position for a count of 3. 1, 2, 3. Then relax and repeat. You will do this 5 times. Lift, hold for 3, relax. Lift, hold for 3, relax. As you do this, you are manually engaging muscle fibers that have been dormant. You are also physically lifting the superficial muscular or neurotic system, the SMAS layer, which is the connective tissue sheet that surgeons physically pull and tighten during a surgical facelift. You are doing mechanically what a surgeon does with a scalpel, except you are training the muscle to hold that position on its own, rather than relying on sutures that will eventually loosen. Do this exercise once a day. Start with 5 repetitions. Within the first week, you can increase to 10. You will feel an immediate tightening sensation after the first session. That is the muscle responding to activation. It is not permanent yet. It is your muscle waking up and saying, I remember what I'm supposed to do. Now, I think of a patient. I will call her Margaret, 67 years old. a retired school teacher from Portland, Oregon. Margaret came to see me because she had noticed her cheeks were descending. She told me, "Dr. Allen, I used to have high cheekbones. I look in the mirror now and I do not recognize the shape of my face." She had spent thousands of dollars on lifting creams, on firming serums, on microcurrent devices. None of it had worked. And the reason, as I explained to her, is that a cream cannot reach a muscle. No molecule in any jar can penetrate through the epidermis, through the dermis, through the hypodermis, and into the muscle belly to tell it to contract and rebuild. Creams sit on the surface. Muscles live beneath. The only thing that activates a muscle is movement against resistance. Margaret began doing these exercises every morning. Within 6 weeks, her daughter, who had not been told about the exercises, asked her, "Mom, did you change something? Your face looks different. It looks lifted." That is the power of targeted muscle activation. Moving to exercise number 4. Exercise number 4 targets your frontalis muscle, the broad, flat muscle that covers your forehead. This is the muscle responsible for raising your eyebrows, and over decades of expressing surprise, concern, and curiosity, it has been creating dynamic wrinkles that eventually become static, meaning they stay even when your face is at rest. Those horizontal lines across your forehead are not just a collagen problem, they are a muscle problem. The frontalis has become chronically tight and shortened, and the skin above it has folded like a piece of paper that has been creased in the same spot 10,000 times. Place your fingertips directly on your forehead, just above your eyebrows. Press down gently but firmly. Now, while keeping that downward pressure, try to raise your eyebrows. You will feel the muscles pushing against your fingers. That resistance, that battle between your muscles trying to lift and your fingers holding them down is the exercise. Hold for a count of 6. 1, 2, 3, 4, 5, 6. Then release. Take a breath and repeat. Do this 5 to 10 times. What you are doing here is forcing the frontalis muscle to work against resistance, which both strengthens the muscle fibers and critically retrains the neuromuscular connection. Your brain and your forehead muscles have been stuck in a pattern of habitual tension for decades. This exercise breaks that pattern. It teaches the muscle to relax fully between contractions. Over time, this reduces the depth of forehead lines because the muscle is no longer permanently contracted beneath the skin. Now, exercise number 3. This one targets the jawline and the platysma, that critical hammock muscle I described earlier. The platysma, when it weakens, allows the skin of the lower face and neck to descend. It is responsible for what people call turkey neck, for jowling, for the loss of jaw definition. That is one of the most distressing signs of aging for both men and women. Here is how you do it. Sit or stand with your spine straight. Look up toward the ceiling, lifting your chin until you feel a gentle stretch along the front of your neck. Do not go too far. You should not feel strain in your lower neck or upper back. You should feel the stretch specifically in the muscles just beneath your jaw. Now purse your lips. Push them forward as though you are giving a kiss to the ceiling. Hold this position for a count of 6. 1, 2, 3, 4, 5, 6. Then relax. Lower your chin. Take a breath and repeat 5 to 10 times. When you do this correctly, you will feel a distinct activation in the underside of your jaw and along the front of your neck. That is the platysma engaging. That muscle, which has been slack and passive for years, is being asked to work for the first time in a long time. And like any muscle that is challenged after a period of inactivity, it will respond. It will rebuild. The skin above it will tighten. Now, this is the point in the video where I need to ask something of you. If you are finding this information genuinely valuable, if this feels like the kind of content that actually respects your intelligence and gives you evidence-based information delivered clearly and without condescension, please take 2 seconds right now and hit the subscribe button below and give this video a thumbs up. This channel exists specifically for adults in their 50s, 60s, 70s, and 80s who deserve access to science-backed health information that can genuinely change how they age. Your support keeps this content coming. Let me tell you about a patient. I will call her Patricia, 72 years old, a retired librarian from Charleston, South Carolina. Patricia had developed pronounced jowls. She told me, Dr. Allen, I have stopped smiling in photographs. I position myself carefully in group pictures so people stand in front of me. She had consulted a plastic surgeon who recommended a lower facelift, a procedure costing over $25,000 with a recovery period of 6 weeks. Patricia was terrified of the surgery. She had a friend who had experienced nerve damage from a facelift and had never fully regained sensation in her lower lip. I taught Patricia this jawline and platysma exercise along with the others I'm sharing with you today. She did them consistently every morning before her coffee, standing in front of her bathroom mirror. 10 weeks later, she called my office. She said, and I am quoting her exactly, Dr. Allen, my jaw is back. I can see my jawline in the mirror. I haven't seen my jawline in 15 years. Now here is the second most powerful exercise on our list. Exercise number 2 targets the orbicularis oris, the circular muscle that surrounds your mouth. This muscle is responsible for puckering, for speaking, for expressing emotion through your lips. After 60, this muscle loses tone. The result is those fine vertical lines above the upper lip, what some call smoker's lines, even in people who never smoked. And the deepening of marionette lines, those creases that run from the corners of your mouth down toward your chin. Here is how you perform it. Make an O shape with your lips. Push them forward as though you are saying the word O. Now take your fingertips and place them at the corners of your mouth as you push your lips forward and outward against the resistance of your fingers. Use your fingertips to massage in small circular motions upward toward your cheekbones and then back down. This combines resistance training for the orbicularis oris with manual stimulation of circulation and lymphatic flow in the surrounding tissue. You do this for about 10 to 15 seconds per repetition, 3 to 5 repetitions per session. It sounds simple. It is simple, but the orbicularis oris is a muscle that gets almost no targeted exercise in daily life. Chewing, smiling, frowning, these movements engage the larger facial muscles, but the fine muscles around the lips are often bypassed. This exercise wakes them up. And now, the moment you have been waiting for, exercise number 1, the most powerful facial exercise I have encountered in my clinical experience. One that combines resistance training, circulatory activation, and lymphatic drainage into a single, elegantly simple movement. I call it the full face L frame lift. Place your hands in front of you. Make an L shape with each hand. Your thumb extending outward at a right angle from your index finger. Now place your thumbs under your jawbone on the soft tissue just behind the bony edge of your chin. Your index fingers go to your temples, just at the hairline above your ears. Your remaining fingers rest gently along the sides of your face. From this position, you are going to lift upward with your thumbs, pressing the tissue beneath your jaw upward and slightly backward, while simultaneously pulling back gently with your index fingers at your temples. You are creating a diagonal lift from the jaw to the temple. Hold this tension for a count of 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then relax. Lower your hands. Take a deep breath and repeat 3 times. Let me explain what is happening when you do this. Your thumbs are engaging the platysma and the muscles of the lower face, lifting them against gravity. Your index fingers at the temples are creating tension across the entire midface, activating the zygomaticus, the levator muscles, and the temporalis. And the sustained count of 15 is forcing these muscles into an isometric contraction, the most effective type of contraction for building muscle endurance and density. Meanwhile, the gentle pressure from your fingers is physically encouraging lymphatic fluid to drain downward toward the lymph nodes in your neck. When you release after the count of 15, you will feel a rush of warmth. That is blood flowing back into the tissue, carrying oxygen and nutrients. I think of a patient. I will call her Eleanor, 74 years old, a retired nurse from Austin, Texas. Eleanor had been widowed for 3 years. She came to me and said, "Dr. Allen, I am ready to meet someone again. I signed up for one of those dating websites for seniors, but every time I look at my photograph, all I see is this person whose face is falling. I do not feel like the woman in that picture." Eleanor had been a nurse for 42 years. She understood anatomy, she understood physiology, but she had never been taught that the muscles of her face could be exercised. I showed her this L-frame lift along with the other exercises. She did them every morning without fail. 12 weeks passed. Eleanor emailed me a photograph, her dating profile picture. She had not had any procedures. She had not spent $1 on treatments. She looked, in my professional assessment, at least 5 years younger than she had 3 months earlier. Her jawline was defined. Her cheeks were lifted. The heaviness around her lower face had visibly reduced. But more importantly, Eleanor said she felt like herself again. She recognized the woman in the mirror. Now recognize the woman in the mirror. Now I want to say one final thing because I believe it matters deeply, and I want to say it directly. We live in a culture that has convinced women and men over 60 that facial aging is something to be ashamed of, something to be hidden, something that can only be corrected by handing over thousands of dollars to a surgeon. And I am not here to criticize anyone who has chosen that path. That is a personal medical decision. But I am here to tell you that you have another option, one that is grounded in the basic biology of how muscles respond to stimulus, one that costs nothing, one that carries zero risk of nerve damage, infection, or failed results. Your face contains over 40 muscles. Those muscles are alive. They respond to attention. They respond to activation. They respond to the simple act of being asked to work. You've been told for decades that aging is a one-way process, that the face only descends, only wrinkles, only loses definition. That is not what the science shows. The JAMAMA dermatology study, the 2025 face yoga clinical trial, the thousands of patients I have worked with in my own practice, all of them point to the same truth. Your body has an extraordinary capacity to rebuild, to tighten, to lift. When given the right signals, movement is that signal. Resistance is that signal. Consistency is that signal. Start with 5 minutes a day every morning before you start your day. Exercise 5, cheek lift and hold. Exercise 4, forehead resistance. Exercise 3, jawline and platysma stretch. Exercise 2, orbicularis oris activation. And exercise 1, the full face L-frame lift. In that order, 5 minutes, 2 or 3 times per week. Initially, do not overwork muscles that have been dormant for decades. After 2 weeks, move to every other day. After a month, daily, if it feels comfortable. You will see changes in the mirror. Others will notice changes in your face. And what you are doing at the cellular level is rebuilding the muscular foundation upon which your skin sits. If you're finding this information valuable, science-based, respectful, and truly useful, please take a moment to hit the subscribe button and give this video a thumbs up. This channel is dedicated to helping adults in their 50s, 60s, 70s, and beyond age with dignity, strength, and natural vitality. Start with just 5 minutes in the morning. Be consistent. Your facial muscles are alive and responsive. They've simply been waiting for the right signals. Drop a comment below. Tell me your age and which exercise you're going to try first. I read every comment and I'm here to support you. Until next time, take care of your body from the inside out. Your future face will thank you. I am Dr. Allen Mandell. Take care of yourselves. God bless you.